Bismillahirrahmanirrahim. Thank you all. Thanks to the team at the Diabetes Center for inviting me and giving this opportunity to talk about diabetes. Today, I'll be talking about diabetes, the diabetes itself, the awareness of diabetes, and the statistical burden of diabetes through global and Pakistani perspective. Now, awareness of diabetes. As we all know, diabetes awareness is crucial for understanding the risk factors and symptoms of diabetes. Therefore, educating communities about healthy lifestyle choices, which includes diet and regular exercise, that all plays an important role in diabetes prevention and management. Regular screening and early detection are essential for timely intervention and treatment of diabetes for better outcome in diabetes care. So all these puts an emphasis on strong advocacy for accessible healthcare services and resources to ensure that all people who have diabetes have access to diabetes care and support. In this slide, we talk about diabetes itself. Now, this yellow organ over there is pancreas. Pancreas plays a pivotal role in blood glucose regulation in our body. Pancreas secretes a hormone called insulin. This insulin acts on our body tissues and makes our body tissues receptive and makes them able to absorb glucose from blood. So decrease blood glucose levels and regulate blood glucose in our blood. Now, there are two main types of diabetes. Diabetes type 1 and diabetes type 2. What happens in diabetes type 1, pancreas stops producing insulin. So there is no insulin in blood. So tissues don't have any access to insulin. So they're unable to absorb glucose from blood, which eventually gives rise to higher levels of glucose in our blood. And in type 2 diabetes, what happens? There is insulin production. Our tissues, they become resistant to the action of that insulin. So there is insulin, but tissues have decreased ability to suck that glucose from blood. There's decreased uptake of glucose, and there's high levels of glucose in our blood. Now, talking more about nitty-gritty of diabetes and looking into type 1 diabetes. Now, we know that in type 1 diabetes, we have no insulin. No insulin means no access of tissues to insulin to decrease their blood glucose, which gives rise to very high levels of glucose in our blood. Now, this unfortunately causes a very acute medical crisis, which is called diabetes ketoacidosis. This is a very critical medical condition. It's a medical emergency which causes acute sickness, makes a person very sick, can lead to coma, and if not treated in timely manner in a hospital, can lead to death. And unfortunately today, a lot of diabetic type 1 people are diagnosed when they go through this diabetic ketoacidosis. Now, looking at diabetes type 2, there are two core defects in diabetes type 2. We know that there is insulin resistance, as we discussed earlier, and there is, in our beta and pancreas, we have dysfunction of insulin secretion through the cells which produce insulin. Risk factors for both of these factors are, number one, genetic susceptibility, which means family history of diabetes. Number two, obesity. Number three, I don't like this word Western lifestyle. It should be unhealthy lifestyle, which means unhealthy diet and poor exercise. With diabetes, if we don't control diabetes, that means there are high levels of glucose in our blood. And these inappropriately high levels are toxic to every part, every tissue of our body from head to toes. So causing a lot of complications affecting almost every organ. If I cite the examples starting from head, our brain causes stroke, eyes causes blindness, heart causes heart attacks, Kidneys, kidney failure, kidney disease, and dominant feet causes gangrenes, and which leads to amputation. So this shows how important it is to control diabetes. Now, coming to some statistical burden of diabetes, and looking through these statistics through global and Pakistani lens. These statistics come from International Diabetes Federation. International Diabetes Federation survey which was done, and there was 10th edition in 2021. So in 2021, there were 537 million adults globally who had diabetes. Here I must mention that 90 to 95% of these diabetics would be diabetic type 2. 5 to 10% would be diabetic type 1. Out of these 537 million people, 6.7 million died of diabetic complications. Now they have projection for future statistics, what will happen in future. And we can see here, in 2045, the numbers have risen exponentially. We have 783 million estimated people that will be suffering from diabetes, which means 1 in 8 people will have diabetes diagnosis. Now, this survey also looks at numbers of diabetes in different countries. So we talk about Pakistan because this project is about Pakistan. Look at point number 1. Pakistan is number 3rd in worldwide with diabetes in adult population after India and China. This is concerning. Then, looking at point number 2, which is more alarming. Pakistan has 30% of people in Pakistan have diabetes, and they have complications, and they are on treatment. Which means that more than 1/3 of people, or like 1/3 of people in Pakistan will have diabetes. And this puts Pakistan at number 1 population preference globally. At number 1, ranked number 1 in the world to have prevalence of diabetes in their population, which is alarming. And the more concerning is about 1/4 of these people who have diabetes don't have access to proper treatment and interventions, which means complications, which means poor diabetes, high complications, and high health and economical burden on a country like Pakistan. Now, diabetes, we have to control diabetes, we have to control blood glucose levels to prevent complications. And as I mentioned earlier, eye is one of them, and blindness is a complication of diabetes. So yearly eye checkups are very important, and people who have diabetes, they should be aware of steps to take to keep their health on track. And this is a very good acronym, track. T stands for take your medication regularly, R for reach and maintain a healthy weight, A for adding more physical activity, C for controlling some indicators like diabetes, blood tests, blood pressure, and cholesterol levels, and K, kicking the habit, smoking habit. Now, this slide talks about, now we know that improving diabetes means less blood glucose levels, which studies have shown that improves outcomes in diabetes. Now, there was a study in 2000 in BMJ, which showed that, look at these numbers, these are quite significant, that how the risk, the amount of risk has come down with proper blood glucose control. Stroke goes down by 12%, heart failure goes down by 16%, heart attacks goes by 14%, and look at this, 43% lower risk of amputations, which is amazing. So that shows how important it is early detection, early treatment, better control of diabetes, and obviously better access to diabetes care. Now in this slide, there's a few things, a few facts about Pakistan. And we can see there's increasing number of obesity in Pakistan. And this says that 50% of population of Pakistan will be obese by 2030, which means more diabetes. 30 million Indian people already, and the number will be rising, which means more complications, feed complications, and last but not least, kidney disease.